and welcome to all of you in this YouTube PYQ marathon session of DBMC MDS. So myself, Dr. Saurabh Bhatia, and I'm your pharmacology guru at DBMCI, and I would be taking this PYQ marathon of pharmacology with you people. So let's start with the question number one. So total we have a session of 1 hour, and in this 1 hour we will discuss 20 questions. So let's start with question number one. So question number one is based on a medicine that is Coumadin. So Coumadin is a drug which inhibits vitamin K by which mechanism? So guys, Coumadin group of medicines, we also call them warfarin group of medicine, right? So the typical example of the drug is warfarin or any drug which has the word coumarin in its name. So any medicine which has the word coumarin in its name or the drug which is warfarin, these medicines have same mechanism of action. So the question is based on these medicines are inhibitor of vitamin K pathway. So they act by which mechanism, right? So all these medicines inhibit vitamin K. Particularly these medicines will act in liver, and in liver these medicines will inhibit one enzyme. Name of the enzyme is VCOR. So how will you remember? It's a VCOR, vitamin K oxidoreductase enzyme. So these medicines will act in liver. They inhibit vitamin K oxidoreductase enzyme so that vitamin K is not able to activate in the liver. And when this vitamin K is not able to activate in the liver, these medicines are inhibitor of synthesis of clotting factor number 2, 7, 9, and 10. So there are four clotting factors which are not been synthesized in the body whenever you take this warfarin medicine or the medicines which are the coumarin group of medicines. So by inhibiting which enzyme in liver? Answer is vitamin K oxidoreductase enzyme. So the question is based on these medicines are inhibitor of this enzyme. This is which type of inhibition? So guys, just for the sake of attempting this type of MCQs, just remember 99.9% of drugs in medical pharmacology are competitive inhibitors. So including this medicine, this is also a competitive inhibitor. So this is a type of competitive inhibitor. Very few medicines are considered as non-competitive inhibitor or the medicines which are irreversible inhibitor, right? For example, if I say which medicines are non-competitive inhibitor, I will say the medicine is acetazolamide. So acetazolamide is one classical example of the drug which is carbonic anhydrase enzyme inhibitor. One more drug is sildenafil. So sildenafil is phosphodiesterase enzyme inhibitor. This is also a non-competitive inhibitor. One more example is like disulfiram. So these are the some examples of the drugs which are non-competitive inhibitor. Very few medicines are irreversible enzyme inhibitor. For example, I would say the drug name is aspirin. Aspirin is used as an antiplatelet drug. This is a irreversible inhibitor of COX-1 enzyme. We have proton pump inhibitors. Proton pump inhibitors are inhibitor of a proton pump. The proton pump is known as H plus K plus ATPase enzyme. Right? So they are irreversible inhibitor of H plus K plus ATPase enzyme. Similarly, we have organophosphates. So some organophosphates are irreversible enzyme inhibitor. So here we are discussing the medicines which are irreversible inhibitor of enzyme. So aspirin is an example, proton pump inhibitor is an example, organophosphates are inhibitor of acetylcholine esterase enzyme irreversibly. And the one more example is a drug known as exemestane. So exemestane is a drug which is a aromatase enzyme inhibitor. So we write it as AEI, that is a aromatase enzyme inhibitor. These are the examples of the drugs which are irreversible enzyme inhibitor. So question number one, answer is competitive blocker. The medicine is warfarin or the coumarin name, coumarin word containing drugs which are known as coumarin group of medicines. Now the antidote of this medicine is obviously vitamin K, and whenever we give such kind of medicines, because they interfere with vitamin K, the first clotting factor that is going to decrease in the body is clotting factor number 7. So first clotting factor, that the level of the clotting factor that will go down, is clotting factor number 7. So these medicines are best monitored by INR. So INR is a parameter that we use for the monitoring of these kind of medicines. So question number one, answer is A. These medicines are the competitive blocker of VCOR enzyme, that is vitamin K oxidoreductase enzyme. Let's move on to question number two. A patient is given gentamicin along with penicillin. So guys, try to understand. Penicillin is a drug. It's a cell wall inhibitor. It's an antibiotic. It's a cell wall inhibitor. So this medicine is a bactericidal medicine. So penicillin is a bactericidal medicine. If we talk about gentamicin, gentamicin is aminoglycoside. This is also a bactericidal medicine. So we are giving combination of two bactericidal medicines. We have given combination of two antibiotic together. Both are bactericidal. And guys, please remember, whenever we give cidal antibiotics or static antibiotics together, this is going to be an additive effect. So 1 plus 1 become 2. So overall efficacy of the treatment will improve. So this is what we have done in this case. We have given two bactericidal antibiotic groups together for the treatment of enterococcal endocarditis. So patient is suffering from enterococcal endocarditis. For the treatment of that, because it's a serious disorder, we have given two group of antibiotics together. Now, which drug need monitoring out of these two? So guys, you must be knowing gentamicin is a drug. This medicine require monitoring. Why this medicine require monitoring? Because this medicine is eliminated by kidney and this medicine is also nephrotoxic, right? So if the patient kidney functions are declined, this medicine require monitoring. So in usual cases, we don't generally require monitoring of this medicine, but in case the kidney functions are declined, gentamicin, which is an aminoglycoside, this medicine require monitoring because in that case, the medicine can cross its safe therapeutic range and can become toxic. If we talk about penicillin, penicillin is a drug which has a wide therapeutic index. So this medicine is not that much toxic even if the patient kidney functions are declined. We can use this medicine very well by decreasing its dose. But gentamicin is a drug which itself is a nephrotoxic, and in patients who have kidney function decline or patients who have kidney dysfunction, this medicine can become toxic to this patient. That's why this patient medicine required monitoring. So question number 2 is based on a knowledge that the medicine which is safe to use, medicine which is unsafe to use, right? Now here we can also say enterococcus. So here the bacteria which is given over here is enterococcus. So the question can be asked, what is the overall drug of choice for enterococcus meningitis or enterococcal meningitis? So guys, please remember the drug name is ampicillin. So ampicillin is a group of medicine that belongs to a class of penicillins. So ampicillin is overall drug of choice for enterococcus bacteria, that is enterococcal meningitis. Now this medicine is always given with aminoglycoside. So medicine is always given with aminoglycoside. Now, in case guys, this bacteria is ampicillin resistant. If this bacteria is ampicillin resistant, so in that case, I will give vancomycin. I will give vancomycin along with aminoglycosides. So in ampicillin resistance, I will replace ampicillin with the vancomycin. So I will give combination of vancomycin with aminoglycoside. And if this bacteria is found to be vancomycin resistant also, that is VRE, we call it vancomycin resistant enterococcus. So guys, in this case, we can give linezolid to this patient. So linezolid is overall drug of choice for this condition that can be given along with aminoglycoside or cannot be given along with aminoglycosides. So linezolid is overall best treatment that we can give, or we can also give a medicine that is daptomycin. So if you have to mark one answer, you will give preference to linezolid. Second answer you will mark as daptomycin. So this is all about question number 2 that we people have discussed regarding this in this PYQ marathon. Question number 2, answer is B, Bombay. Okay, now let's talk about question number 3. So question number 3 is based on anti-tubercular drug, that is INH. So it's a isoniazid. Now, whenever we give isoniazid to a patient, this medicine can cause deficiency of one vitamin in the body that can result in neurotoxicity. So that vitamin is the one that is required to keep our nerves in a stabilized state, right? So our nerves have a tendency to get depolarized. So this vitamin will maintain the nerve resting tone, and therefore the nerves will not fire. So in case of deficiency of that vitamin, patient can have seizures, patient can have neuropathy also. So patient can have neuropathic pain. So patient can suffer from neuropathic pain, patient can have seizures, patient can also have the optic neuritis. Patient can also have optic neuritis because of the deficiency of that vitamin. So that vitamin is required for the normal nerve conduction, and the name of the vitamin is vitamin B6. So vitamin B6 is the one that is responsible for this stabilization of the nerve sheath. And in case of INH, if you give INH, that will cause deficiency of this vitamin in the body and can cause all these symptoms. So pyridoxine is the name of that vitamin. So question number 3, answer is C, pyridoxine is the answer, right? So in case we talk about this INH further, so isoniazid is a drug. This medicine is a bactericidal antibiotic. This medicine is a bactericidal antibiotic against tuberculosis. This medicine mechanism of action is it's a cell wall inhibitor. This medicine is a cell wall inhibitor. Particularly, this medicine inhibits mycolic acid synthesis. So this medicine is inhibitor of mycolic acid synthesis. So it's a cell wall inhibitor. Number 3 point regarding this medicine, this INH is a drug. This medicine resistance. If we talk about the resistance, how the bacteria will develop resistance against this antibiotic. So the most common resistance mechanism is mutation of a gene We call it CAT-G gene. So CAT-G gene is the one that is mutated, and this is the gene that will result in formation of an enzyme that is known as catalase enzyme. So catalase enzyme is the one that is required by the drug to become activated. So this is the gene. If it is mutated, the medicine cannot be activated in the bacteria and it cannot inhibit the cell wall of the bacteria. So this is the gene that should be normal for the normal activity or the normal action of this drug. If this gene is mutated, the catalase enzyme is not available. Medicine cannot be activated in the bacteria to inhibit its cell wall. Now, apart from that, guys, INH is a medicine that is also given for TB prophylaxis. Along with TB treatment, this medicine is also given for TB prophylaxis to high-risk patients who get exposed to TB positive patients. Apart from that, if we talk about other side effects of isoniazid, so isoniazid is a drug. This medicine can cause hepatotoxicity as a side effect. So this medicine can cause hepatotoxicity as a side effect. One more side effect is SLE-like symptoms. So medicine can cause SLE-like symptoms, hepatotoxicity. Plus, this medicine can also result in vitamin B6 deficiency that will lead to three important manifestations that we people have already covered above. So question number 3, answer is C. So that we people have discussed, answer is pyridoxine. Now let's move on to question number 4. So if we talk about this question number 4, which antibiotic does not act by protein synthesis inhibition? So guys, this topic like protein synthesis inhibitors and cell wall inhibitors, this topic is based on mechanism of action of antibiotic. Now this topic is very important for the examination point of view. They can give you the name of any antibiotic and they will ask you what is the mechanism of action of this particular antibiotic. So antibiotics mechanism of action very important. So here the answer is vancomycin. So vancomycin is a medicine. It's not a protein synthesis inhibitor, but this medicine is a cell wall inhibitor. So this medicine is a cell wall inhibitor. This is not a protein synthesis inhibitor. If we talk about this vancomycin further, this vancomycin is always given by IV route. So vancomycin is an antibiotic which is always given by IV route, except in one condition where it can also be given by oral route. And that condition is pseudomembranous colitis. So pseudomembranous colitis is a condition which is caused by Clostridium difficile bacteria. And this in this condition, we give vancomycin by oral route. Otherwise, this medicine is always given by IV route. If we talk about this vancomycin further, this vancomycin is overall considered as drug of choice for MRSA. So methicillin resistant Staph aureus, this medicine can be used as a best medicine. One of the important side effect of this drug is this medicine can release histamine. Medicine side effect is medicine can release histamine in the body, and by releasing histamine in the body, this medicine can cause red rashes everywhere on the skin. So medicine can cause red rashes as an important side effect. No doubt this medicine can also damage the kidney. So medicine can cause nephrotoxicity as one of the side effects. But red rashes, histamine release causing red rashes is more important for the examination point of view. If we talk about other medicines belong to this class, so I will say other three medicines belong to this, given this MCQ are protein synthesis inhibitor. So if we talk about the medicines which are inhibitor of protein synthesis, so these medicines we can divide further in two classes. So medicines can act on 30S ribosome and medicines that will act on 50S ribosome. So we have two classes of medicines, medicines that will act on 30S ribosome, medicines that will act on 50S ribosome. These medicines are protein synthesis inhibitor. So the drugs that will act on 30S ribosome inhibit protein synthesis. Medicines are like aminoglycosides. So aminoglycosides are the medicines which will act on 30S ribosome, inhibit protein synthesis. We have discussed already in the previous question. This is a bactericidal antibiotic. Second is tetracyclines. So tetracycline is a second group of medicine that will act on 30S ribosome, inhibit protein synthesis. Medicines that will act on 50S ribosome, example is like macrolides. So macrolides will act on 50S ribosome, one example. Second example is like linezolid. So linezolid is the drug that will also act on 50S ribosome. And the third example is like clindamycin. So clindamycin, linezolid, macrolides. One more example in case you can remember is chloramphenicol. So one more drug is chloramphenicol. So the drug name is chloramphenicol. So chloramphenicol is a drug that will also inhibit uh, protein synthesis in the bacteria. So chloramphenicol, clindamycin, linezolid, macrolides, these medicines will act on 50S ribosome. So guys, if you go back to the previous question, we can see chloramphenicol, this will act on 50S ribosome. Gentamicin is an aminoglycoside, this will act on 30S ribosome. Erythromycin is a macrolide, this will act on 50S ribosome. So question number 4, answer is B, Bombay. Let's move on to question number 5. So we talk about question number 5. Question number 5 is based on anionic and the weakly acidic drugs mainly bound in plasma to which type of protein. So here the answer is albumin. So guys, if we talk about plasma protein binding, if we talk about plasma protein binding of the drug, then I will say, if we talk about this plasma protein binding, I can divide medicines grossly in two groups. So I can say medicines can be acidic in nature, medicines can be basic in nature that we give to any patient, right? And all medicines that we use clinically are weak acid and weak base. So we never use strong acid and strong base as a drug. We always use weak acid and weak base as a drug. This is for the plasma protein binding. Now, the weakly acidic drugs that we use clinically, they will always bind to albumin. So, albumin is the main protein to which the weakly acidic medicines will bind, and the basic drugs will bind to alpha 1 acid glycoprotein. So, basic drugs will bind to alpha 1 acid glycoprotein, and acidic drugs will bind to albumin as a protein. Right? Now, the question can be asked which medicines are acidic in nature? So, please remember, guys, most of the drugs that we use clinically, most of drugs that we use clinically are acidic in nature, but you people have to remember three medicines for your examination point of view that you can remember with the mnemonic, that is MAP. So please remember, guys, methotrexate. Methotrexate is acidic medicine that can bind to albumin. Second medicine, aspirin. Aspirin is a second example of an acidic drug. Third example of the medicine is phenobarbital. So methotrexate, aspirin, phenobarbital are three medicines that are the classical examples of the medicines which are acidic in nature, that can bind to albumin, and that are important for your examination point of view. If we talk about basic drugs, so which medicines are basic in nature? So most of the medicines that we get from plants and trees. So most of the medicines that we get from plants and trees, like atropine, like we have an example, atropine, we have an example, pilocarpine. So atropine, pilocarpine, morphine. So all these medicines which we get from plants and trees, all these medicines are basic in nature. Apart from that, we have some local anesthetic drugs like lignocaine. So local anesthetic drugs, lignocaine is also a basic drug. So guys, have you noticed one thing? Most of the basic drugs ends with the word INE. So most of these drugs end with the word INE, like morphine, pilocarpine, atropine, lignocaine. One more example is like amphetamine. So these are the medicines which are examples of basic drugs. They will bind to alpha 1 acid glycoprotein. Now guys, here you can also remember one more point. Medicines which are acidic in nature, whenever we have the toxicity of these medicines, so what is the treatment of choice for the toxicity of these three medicines? So the answer is forced alkaline diuresis. So forced alkaline diuresis is the treatment of choice. Forced alkaline diuresis is the treatment of choice for these three medicines toxicity. But if we talk about like basic drug amphetamine, so for the amphetamine toxicity, treatment of choice is forced acidic diuresis. So forced acidic diuresis is treatment of choice for amphetamine toxicity, and forced alkaline diuresis is treatment of choice for acidic medicines toxicity. This is all about question number 5. Question number 5, answer is A. Let's talk about question number 6. A patient who is a known case of liver cirrhosis. Patient who is a known case of liver cirrhosis presented with ascites and bilateral pedal edema. Now, which of the following diuretic is treatment of choice? So, guys, here they have clearly given the situation. The patient is suffering from only liver cirrhosis, right? So in liver cirrhosis, because of plasma protein deficiency, if your liver is failed, this liver cannot make the plasma proteins, and if liver cannot make the plasma proteins, you must be knowing the fluid will start shifting from plasma to the tissues, that will result in ascites. So liver cirrhosis, patient can have the ascites. And this patient has also got the bilateral pedal edema. Now bilateral pedal edema can be or cannot be associated in this patient of ascites, right? This may be a presentation of CHF, but in this case, there is no option given as CHF. They have clearly given the history. Patient is a known case of liver cirrhosis, not the CHF. So here I will rule out the CHF, because the bilateral periodic edema can be a presentation of CHF, can be due to anemia, can be due to other reasons. So nothing is given. They have just clearly mentioned over here the patient is suffering from liver cirrhosis, no other disease. Otherwise, they must have given to us in this MCQ. So I will consider this patient as a case of only liver cirrhosis. Patient has got ascites, also has got pedal edema. Now they are asking what is the treatment of choice. So guys, please remember, treatment of choice for ascites is aldosterone receptor antagonist. So we have a drug eplerenone, that is aldosterone receptor antagonist. So aldosterone receptor antagonist is the best medicine for the treatment of ascites. So if I say If I say this is a patient, now in this patient, if I draw the various types of edema, then I would say patient can have this cerebral edema. Patient can have cerebral edema. Now, what is the drug of choice for cerebral edema? Then you will mark answer as a mannitol. So for cerebral edema, you will mark the best medicine as a mannitol. So mannitol is the drug of choice for cerebral edema. Now sometimes the patient can also have the raised ICT. Now even for the raised ICT, you will mark mannitol as the best medicine. You will again mark mannitol as the best medicine, but the second best medicine you will mark as acetazolamide. So acetazolamide is the second best medicine, and raised ICT, mannitol is drug of choice. Now after this, we can have the eyes. So if we talk about this eyes, in eyes there are two types of MCQs they can ask. First is they can ask you what is the best medicine for periorbital edema. What is the best medicine for periorbital edema? Edema around eyes that is very commonly associated with CKD. Now here you will mark the loop diuretic like furosemide as a drug of choice. So furosemide is a drug of choice for this periorbital edema. Further, they can ask you what is the best medicine for raised intraocular pressure. We also call it angle closure glaucoma. So for angle closure glaucoma, for raised intraocular pressure, they can ask you which medicine you will mark as the best medicine. So here you will mark acetazolamide as a first drug. Second diuretic that you can mark over here is mannitol. Apart from that, they can ask you which medicine is best medicine for CHF with pulmonary edema. So patient can have CHF with pulmonary edema. Now for CHF with pulmonary edema, you will mark the best medicine again as furosemide. So furosemide is a drug of choice for CHF with pulmonary edema. Plus they will ask you which medicine is the best medicine for liver cirrhosis edema or liver cirrhosis ascites. So here again we have discussed that you will mark the best medicines as aldosterone receptor antagonist. So aldosterone receptor antagonist you will mark as the best medicine. In case they are not given, you can mark furosemide also. So furosemide can also be marked as a drug of choice. So aldosterone receptor antagonist plus furosemide combination usually we give, but the first is ARA, second is furosemide that you will mark, right? Now, apart from that, if the question is asked to you, what is the best medicine for pedal edema? So last type of edema is pedal edema. So what is the best medicine for the treatment of pedal edema? So here you will mark again as loop diuretics as the drug of choice. So in loop diuretics, the medicine name is furosemide, torsemide. These medicines can be given. So these are the drug of choice for different types of edema that the patient can come to you in clinics. So guys, here intentionally I have left one edema for you because that is not important for your MDS entrance. There is a anasarca. So we call it anasarca, and it is quite commonly associated with nephrotic syndrome. So this is not the scope of this lecture. So I'm just leaving this nephrotic syndrome. So nephrotic syndrome associated edema I'm not covering here. The rest of the edemas I have covered. You have to mark the best medicines for different types of edemas. One question for you, like assume a patient has come to you with a calcium channel blocker, amlodipine. And when the patient is taking this amlodipine, patient can develop pedal edema. So assume you are sitting in OPD and a patient has come to you. Patient is giving you history, ki, sir, I consume calcium channel blocker. Maybe because you people are dentist, maybe the patient is taking nifedipine. So patient is taking nifedipine and patient has come to you with gum hypertrophy. One of the side effect of nifedipine is gum hypertrophy. So patient has come to you with gum hypertrophy with pedal edema. Now, my question is, which medicine would you like to start in this patient so that it will relieve the pedal edema caused by calcium channel blocker? So this you have to answer in the comment box, right? Okay, let's move on to question number 7. I hope you people are understanding up till here. So we talk about question number 7. A 45-year-old lady under the medication for acute angle closure glaucoma. So she is a case of angle closure glaucoma. Now she is diagnosed with depression. That's quite obvious, like quite commonly seen in females after menopause. So 45-year-old females, depression or mood disorders are quite commonly seen. Now, which drug should not be given to this patient, right? So please remember, guys, whenever you see the history of glaucoma in any of the MCQ, in any of the disorder, please remember anticholinergic drugs. Anticholinergic drugs which have the tendency to cause mydriasis. So anticholinergic drugs that will cause mydriasis, these type of medicines are strictly contraindicated. So guys, there are two contraindications of anticholinergic drug. First contraindication is glaucoma. Second, if the patient is suffering from retention of urine. So anticholinergic drugs can cause mydriasis, can close the angle of the eye further and can result in glaucoma again. So anticholinergic drugs strictly contraindicated in patients of glaucoma. as well as these medicines should not be given to a patient of retention of urine. So any patient suffer from retention of urine, they are again contraindicated. Also, they are contraindicated in patients of glaucoma. So here you have to find out which antidepressant medicine has an anticholinergic property. So if I say sertraline, you can see the name sertraline. It starts from a word serotonin. Sertraline is a medicine that starts with the word serotonin. So this medicine is SSRIs, and there is only one SSRI which has anticholinergic property, and that is an paroxetine. So all SSRIs are devoid of this side effect. They are not having this side effect. They cannot cause anticholinergic property. So SSRIs we can completely ruled out. They will not cause anticholinergic effect. So sertraline, fluvoxamine, these medicines are SSRIs. These medicines have been ruled out. Now guys, we have a drug metazapine. Now metazapine is a drug which is a type of atypical antidepressant. So this is a type of atypical antidepressant medicine. So this is also ruled out. This will not have any anticholinergic property. So here the answer is amitriptyline. So as if you see the name of a medicine, amitriptyline. So in amitriptyline, you can find the word TRI. So from this TRI, can you find out this medicine belongs to which class? Yes, this medicine belongs to tricyclic antidepressants. So amitriptyline are having the word, this medicine is having the word TRI. So it's a tricyclic antidepressant medicine. So we have nortriptyline, amitriptyline, all these medicines are tricyclic antidepressant medicine. If we talk about tricyclic antidepressant medicine, how will you remember the side effect of tricyclic antidepressants? So you can remember with the mnemonic, that is Hamas. You must be knowing this Hamas word is nowadays very common because of the war that is going between Hamas and the Palestine. So Hamas is a very commonly used word these days. So you can remember with the mnemonic Hamas. So this medicine has antihistaminic property. So these medicines can block the histamine receptor. So by blocking histamine receptor, these medicines can cause sedation and drowsiness as a side effect. Plus, these medicines can cause weight gain. So by blocking histamine receptor, all medicines can cause the same side effect: sedation, drowsiness, and weight gain. Medicines can block the alpha 1 receptor. And by blocking this alpha 1 receptor, these medicines can cause hypotension as a side effect. Medicines can also block the muscarinic receptor. And by blocking muscarinic receptor, medicine has anticholinergic property. Medicine has anticholinergic side effect like mydriasis, like dry mouth, dry eyes. So dry mouth is important for you. So these medicines have anticholinergic property, can cause dry mouth, dry eyes, can result in mydriasis, that is a dilatation of the pupil. So these medicines have anticholinergic property. Now these medicines can also cause arrhythmia as a manifestation. So A stands for arrhythmia. Now S stands for seizures. So these medicines can cause seizures and sexual dysfunction as a side effect. So S stands for two side effect, seizures and sexual dysfunction. A stands for arrhythmia, antihistaminic property, alpha 1 blocking property, anti-muscarinic property. So these are the side effect of the medicines which you can remember with the mnemonic Hamas. Now guys, they can also ask you the TCA toxicity. So tricyclic antidepressant toxicity is also very common. The reason is the patient is depressed, patient wants to commit suicide. When the patient wants to commit suicide, TCA is a very commonly accessible source which patient can consume in high dose and patient can commit suicide. So in TCA toxicity, all these symptoms of Hamas will get aggravated. So all these Hamas symptoms will get aggravated, plus patient will develop metabolic acidosis, and this is responsible for patient death. So for TCA toxicity, if they will ask you what is the antidote of choice, so the antidote of choice for TCA toxicity, you will mark sodium bicarbonate. So sodium bicarbonate is the one which can neutralize this acidosis, and this is the antidote of choice for TCA toxicity. So this topic is based on tricyclic antidepressant anticholinergic side effect. So question number 7, TCA toxicity, sodium bicarbonate is the antidote. In the treatment of TCA toxicity, guys, please remember atropine, which is an anticholinergic drug, as well as a drug known as physostigmine, which is a cholinergic drug. Both medicines are strictly contraindicated. This is one of the expected MCQ in the upcoming exam, right? So please remember atropine has an anticholinergic property and physostigmine is a cholinergic drug, right? This medicine has a tendency to cause heart block. This medicine can further aggravate the heart block that can be associated with the arrhythmia, right? So heart block, physostigmine, atropine is anticholinergic, strictly contraindicated in TCA toxicity. Question number 7, answer is B Bombay, amitriptyline. Now let's move on to question number 8. Which anticoagulant is recommended in arterial blood gas sampling? So in arterial blood gas sampling, heparin is the drug that is used. It's a fact-based question. So sometimes in your exam, they also ask you a fact-based question. So if we talk about this heparin as an anticoagulant, this medicine mechanism of action. Heparin mechanism of action is this medicine can stimulate one enzyme known as antithrombin 3 enzyme. This medicine can stimulate one enzyme in blood known as antithrombin 3 enzyme. Now, this antithrombin 3 enzyme will activate one protein known as NT10A protein. So this will activate NT10A protein. So antithrombin 3 enzyme is activated. This will further activate NT10A protein. This will inhibit factor 10A. So heparin can inhibit factor 10A and this enzyme can also inhibit factor 2A. So heparin is a drug can inhibit both clotting factor, factor 10A as well as 2A. So heparin mechanism of action, it's an inhibitor of clotting mechanism. It inhibits factor 10A and 2A. Nowadays, guys, we use low molecular weight heparin for systemic purpose. So for systemic purpose, we are using a heparin. We call it low molecular weight heparin. And how will you recognize this low molecular weight heparin in exam? So any drug that ends with the word parin, any drug that ends with the word parin is a low molecular weight heparin. So here in the comment box, you have to answer the name of a drug that you know that medicine name ends with the word parin. So I will say that medicine is a low molecular weight heparin. So you have to give me the example of the drug which is a low molecular weight heparin, right? But apart from that, guys, please remember, if we talk about low molecular weight heparin further, this medicine monitoring is best done by APTT. So this medicine monitoring is best done by APTT. Now this medicine is safe to use in pregnant female. So heparin is a drug that is safe to use in pregnant female. And whenever we give heparin as a drug to a patient, medicine side effects are this medicine can cause hyperkalemia. This medicine can cause hyperkalemia. Medicine can cause hypocalcemia. Medicine can also result in osteoporosis as a side effect. So result in hyperkalemia, hypocalcemia, osteoporosis can be caused by this medicine, low molecular weight heparin. So question number 8, answer is D, Delhi. Let's talk about question number 9. So if we talk about question number 9, the patient has come to you with showing the signs of cholinergic poisoning, right? Now, patient has given the history of mushroom intake. So guys, please remember from mushroom, you can remember muscarinic receptor. So muscarinic receptor means cholinergic receptor. So there are some poisonous mushroom. So whenever patient consume those poisonous mushroom, muscarinic receptor, cholinergic receptors are stimulated and that will lead to symptoms of cholinergic poisoning. Now, after making the diagnosis, you have given the anti-muscarinic drug. Anti-muscarinic means anti-cholinergic drug. Muscarinic receptor means cholinergic receptor. So you have given some anti-cholinergic drug to a patient. Now, which sign will not be consistent? Which sign will not be consistent with the action of muscarinic agonist? So which action is not caused by muscarinic agonist? So have you seen the twist in the question? They have said the patient has got cholinergic poisoning. Now they have said they have given anticholinergic drug. Now they are saying which action is not seen in this poisoning, which is a cholinergic poisoning. So guys, please remember if we talk about the cholinergic actions in the body, which we can remember with the mnemonic that is dumbbells. So we can remember this mnemonic with the help of a mnemonic that is dumbbells. So cholinergic actions. So in this mnemonic of dumbbells, we will say patient should have diarrhea. So D stands for diarrhea. Patient should have dilatation of blood vessels. So blood vessels should be dilated. That will lead to fall in blood pressure. So patient BP should be low. Patient should have diarrhea. Patient can have urinary incontinence. So we call it urination. Patient should have meiosis, that is pinpoint pupil. Meiosis means pinpoint pupil. Patient can have bradycardia. So patient can have bradycardia. Patient can have bronchospasm. So B stands for two things, bronchospasm, bradycardia. Patient can also have the erection, right? So muscarinic action is erection. Now LSS, so we have the LSS, that is lacrimation, salivation, sweating. So all glandular secretions are increased. So all glandular secretions are increased. So S stands for secretions. So all secretions are increased by this muscarinic action. Right, guys? So here we have a dumbbells as a mnemonic. So dumbbells we can remember as a mnemonic for the cholinergic action. So here they are asking which is not consistent with the muscarinic agonist or the cholinergic action. So answer is pupillary dilatation. So instead of pupillary dilatation, patient should have the meiosis, the pupillary constriction. Rest everything will be there. Bradycardia will be there. Diuresis will be there. Instead of diuresis, the better word should be the urination. Because guys, diuresis is something which is related to the GFR. But the better word is urination. But still the best answer here is pupillary dilatation. If you ask me, sir, what is the best answer? Answer is pupillary dilatation. Second best answer will be diuresis because diuresis is something related to the urine formation. It's not the act of urination, it's a urine formation that will take place in the kidney and that has nothing to do with this muscarinic, right? Now, smooth muscle contraction is possible, like you can see bronchospasm. So, bronchospasm, the smooth muscles are getting contracted, right? The bladder muscles are getting contracted, right? The JT muscles are getting contracted, so smooth muscles will be contracted. So, question number 9, answer is A. Now let's talk about question number 10. So if we talk about question number 10, a patient has taken tablet of amoxicillin 500 milligram. So patient has taken tablet of amoxicillin 500 milligram written on it, and now this tablet is investigated by the government authority. Now government authority has found the only 200 milligram amoxicillin is there in that tablet. Like you open the strip of a medicine, here you will find a tablet. Here it is written on the tablet. The medicine is 500 milligram amoxicillin. But when you send this tablet for the examination, ultimately this medicine contains only 200 milligram of the salt instead of the 500 milligram salt. So this is a spurious activity, right? So this is a spurious. This is a spurious drug when your drug is having some alternative thing. Like if ideally the drug should contain only 500 milligram amoxicillin, but instead of 500 milligram amoxicillin, medicine is only having 200 milligram. Rest 300 milligram is something else that can be a base of the drug, can be a other thing like which may not be very toxic for a patient, which may be edible to the patient, but that is an alternative of the drug that has been used. So this is a spurious activity which government has found. Now some students may be asked, okay, sir, why not it's a misbranded drug? So guys, misbranded drug will be like in case misbranded will be like you know that there is a label of the drug, right? So on the drug label, there is a few prerequisite that is required. There are some information that must always be present on the drug label. Let's take an example. So on the drug label, you must be knowing the medicine name should be there. Medicine strength should be written over here, right? Company name should be there. Company address should be there, right? Medicine belongs to which schedule of the drug that should be there, right? And also on this drug label, you should find the expiry date. So why not this drug is misbranded? This drug would be misbranded if the name is missing, right? If the strength is missing, like if you're on the drug label, you will find amoxicillin is written. It is written that this medicine contains amoxicillin. How much amoxicillin? This word is missing. Like nothing is written. It's 500 milligram, 200 milligram, nothing is written. So it's a problem of the label. It's a problem of the label. So we call it mislabeled medicine, misbranded medicine. So misbranded medicine when there's a mistake in the label. So in this case, it is written on the label that the medicine contains 500 milligram, and when you open it, you find 500 milligram. But later on, when you send for the examination, you have found there is something spurious in it, something, some fishy thing in it, and you have sent it for examination, and then it is a spurious activity. Have you understood, guys, the difference between two? It's not a misbranded medicine, it's a spurious medicine. Now, adulteration means when the medicine contains something that is hazardous to the health directly. Like if I say the medicine is 500 milligram, but it also contains something that can be harmful for your health. Like it contains human hair, it contains some fungus grown on it. So that contains something that is hazardous to your health directly. That is an adulterated drug. There is no terminology like unethical in Indian law, so we will not discuss unethical drug. So we have three terminology in Indian law, that is misbranded drug, adulterated drug, spurious drug, right? So misbranded means when there is a problem in the drug label. Now there's a question for you people. I'm just giving you one example. So you have purchased a medicine from a market, right? And you have asked the chemist to give you a medicine. Let it be Viagra. Let it be sildenafil. So you ask the chemist to give you sildenafil. Now, when the chemist has given you the sildenafil, you have found the brand name of sildenafil is given as Crocin. Now you have to tell me in the comment box, this is which activity? Is this spurious? Is this adulterated? Or is this misbranded drug? Understood this point? You people want to get involved in the intercourse. You people have asked the chemist to give you the sildenafil as a salt, but he has given you one tablet. that he said that it this contains sildenafil. He said that this medicine contains sildenafil, but the name of the medicine, with the brand name of the medicine is Crocin. You have to tell me this is which activity. Is this misbranded drug, adulterated drug, or this is an spurious drug, right? You have to answer me this question in the comment box. Question number 10, we people have covered. So let's move on to question number 11. So this question number 11 is based on morphine. So we have discussed already in the one of the previous question. Morphine is an alkaline drug. It ends with the word INE. It binds to alpha 1 acid glycoprotein in the plasma. Now this is an opioid which we use as a painkiller. Now which of the following are the actions of opioid or the morphine? They are asking, right? So guys, please remember here the answer is morphine can cause bronchospasm, no doubt about that. So whenever we give morphine to a patient, these are the medicines which we get from plants and trees. So any medicine that we get from plants and trees, that medicine can release histamine. So morphine can release histamine, and this histamine can result in bronchospasm as a side effect. This is applicable to all alkaline drugs that we get from plants and trees. So these medicines that we get from plants and trees, their structure is so huge that they will go and stimulate the mast cell and they release histamine. So all these medicines can cause same problem like bronchospasm. They can also cause pruritus. They can also cause pruritus because of histamine. They can also cause vasodilation. They can also cause vasodilation due to histamine and can result in hypotension. Now, morphine is used as a painkiller. It's one of the wonderful painkiller, and we know that morphine is drug of choice for post-operative pain. So, opioids are drug of choice for post-operative pain. That includes morphine also. So, drug of choice for cancer-associated pain, drug of choice for post-operative pain. Answer is opioids, and one of the high-efficiency opioid is morphine. Now, morphine is a drug that can also cause meiosis. So, guys, morphine is an abusive drug. You must be knowing morphine has an abusive ability. So, any person who is morphine addict, any person who is an opioid addict, please remember, you can find tolerance to all the actions of opioids. You can find tolerance to the all the actions of opioid except meiosis. So, meiosis and constipation are two things, two actions of morphine against which you will not find any tolerance of the body. You can have tolerance against all other actions, like you can have the tolerance to this analgesic effect of morphine, but you will not have the tolerance to meiosis and constipation. Now, instead of tachycardia, morphine can cause bradycardia, right? So instead of tachycardia, morphine can cause bradycardia. So here the answer is B, C, and D. Three statements are true. So how will you remember this morphine action? So for morphine action, I will give you one mnemonic. The mnemonic is PM cares. So morphine is a drug. This medicine will act on mu receptor. The receptor name is mu receptor, and this medicine can cause PM cares. You know that our honorable Prime Minister Narendra Modi cares for us. So PM will always care for us, right? So this will cause physical dependence. So this medicine is associated with physical dependence. So physical dependence chances are there. Meiosis will be there. This can also cause muscle rigidity. So chances of muscle rigidity will also be there. Now C stands for constipation. So opioids can result in constipation. A stands for analgesic effect. A stands for analgesic effect. R stands for R stands for respiratory suppression. Respiratory center will go down. So R stands for respiratory suppression. Now E stands for euphoria. So opioids are associated with euphoria. S stands for sedation, and rarely these medicines can also result in seizures. So the mnemonic is PM cares: physical dependence, meiosis and muscle rigidity, constipation, analgesic effect, respiratory suppression, euphoria, sedation, and seizures. Now, whenever we give morphine in very high dose, whenever we give morphine in very high dose, the cardiovascular center is also inhibited, and as a result of that, the BP and the heart rate will also go down. So C stands for CVS suppression, right? So this is a mnemonic to remember the actions of opioids in the body. So question number 11, answer is C. Now let's talk about question number 12. So question number 12 is based on what are the essential drugs. So this is very easy question. Essential drugs are those medicines that will cater the majority of the public health problem. So whatever problems are going on in some country, there is a list of medicine that is developed in that country, and that is a list of essential drugs. So these medicines should be available all the time in the public health, right? Medicine should be available all the time in sufficient quantity and in sufficient rate also. Like this should not be very costly medicines, right? And in this list of essential drugs, we always avoid to include the FDCs. So fixed dose combinations are avoided. We mostly have the single medicines names. We have very less fixed dose combination in this essential drug list. So essential drugs are those drugs which can cater the major public health problems of the country, and they should always be available in sufficient quantity, at sufficient price, and in sufficient quality, bestest of quality, so that the patient will get the bestest of the health facility in the country, right? So question number 12, answer is C. Question number 13, if we talk about which of these cells have the maximum affinity for bisphosphonates? So bisphosphonates, guys, are the drug of choice for osteoporosis. These medicines are the best medicines for osteoporosis. So whenever we give bisphosphonates to a patient, so if I say this is the bone, so bisphosphonates are the drugs that will go and take entry in the bones. So here the D stands for drug. So drug becomes the part of this bone. So whenever we give bisphosphonates, the medicine become part of the bone. So whenever the osteoclast will come, so this is the osteoclast which will come. So osteoclast is actually a macrophage. Osteoclast is actually a macrophage or monocyte. So monocyte become macrophage after entering in the bones, right? We start calling it macrophage, right? Now this osteoclast will start the bone resorption. When this osteoclast will start bone resorption, this drug is released from the bone. And when this drug is released from the bone, now the drug is engulfed by the osteoclast. Now, after taking entry in the osteoclast, this medicine can result in increased apoptosis. This can result in increased apoptosis of the osteoclast. So osteoclast will die. When osteoclast will die, osteoblast activity will continue, and that will lead to more bone formation. So bone resorption is inhibited. So this medicine has a maximum activity to osteoclast. So question number 13, bisphosphonates mechanism of action. They are the inhibitor of osteoclast that will lead to unchecked activity of osteoblast, and that will lead to more bone formation. They are the best medicines for osteoporosis. Now, one of the important side effects of this medicine is osteonecrosis of jaw. One of the important side effects of this medicine is osteonecrosis of jaw. Medicines can also lead to bone fracture. So these medicines can lead to osteonecrosis of jaw and bone fracture when given for long-term treatment. So when these medicines are given for long-term treatment, these medicines can cause osteonecrosis of jaw, can result in bone fracture as a side effect. So these medicines should be stopped after a certain limit. Medicines should not be given lifelong, should not be given for a long time. Medicine should be stopped after a certain limit. Now this risk is maximally seen with the drug known as zoledronic acid. So zoledronic acid is a medicine which has the maximum risk of this side effect. So this medicine should not be given. Should not be given continuously to a patient for more than 3 years. I can give this medicine for 3 years. I have to stop the medicine at least for 1 or 2 years more. Right? After 3 years, I have to give a halt to the medicine treatment. So I cannot give this medicine beyond 3 years, otherwise this side effect can appear. So question number 13, answer is osteoclast. Let's move on to question number 14. A new anesthesia resident mistakenly given parasympathetic drug. Now, guys, parasympathetic drug means cholinergic drug. So, by mistake, the doctor has given cholinergic drug to a patient who is a male patient. Now, what is the immediate effect that is seen? So, again, the answer is Dumbbell's effect. So, again, the answer is Dumbbell's effect is seen where the E stands for erection. So, in the previous question, we people have already covered. So instead of bronchial dilation, bronchospasm will be there. Instead of mydriasis, meiosis will be there. Instead of decreased urine output, rather there is a urination. So penile erection will be seen. Now, guys, cholinergic drugs can result in vasodilation. So we discussed already above. D stands for dilatation of the blood vessel. Now, this is possible because of the induction of the enzyme known as nitric oxide synthase enzyme. So cholinergic drugs will stimulate muscarinic receptor. And when they stimulate muscarinic receptor, they stimulate one enzyme known as nitric oxide synthase enzyme. Now, nitric oxide synthase enzyme will form nitric oxide. This nitric oxide will increase cyclic GMP, and this cyclic GMP will cause vasodilation. This is how the vasodilation will take place in kidney. This is how the vasodilation will take place in body as well as in penis. And because of the vasodilation in the penis, patient can have the erections. So question number 14, answer is D, Delhi. Let's move on to question number 15. How we give adrenaline to a patient. So how we give adrenaline to a patient in treatment of anaphylactic shock. So the best route is intramuscular route. So guys, if we talk about this adrenaline, so adrenaline is a medicine. This is considered as drug of choice for anaphylactic shock. So this medicine is considered as drug of choice for anaphylactic shock, and this is also considered as drug of choice for cardiac arrest. So it is considered as drug of choice for cardiac arrest, drug of choice for anaphylactic shock, and this medicine is also given along with local anesthetics. So when I use this medicine for anaphylactic shock, this medicine is used in a concentration that is 1 is to 1000. Medicine is used in a concentration 1 is to 1000. The dose of the medicine is zero point 0.5 milligram. Dose of the medicine is zero point 0.5 milligram, and the volume of the medicine that we have to inject is zero point 0.5 ml. So please remember, guys, the concentration is 1 is to 1000. This contains 1 milligram drug per ml. So if I want to give zero point 0.5 milligram drug, I have to give zero point 0.5 ml of the liquid. Now, what is the route of administration? The route of administration is intramuscular route, and it is given on the outer part of the thighs, right? So it is given on the lateral part of the thigh. So the thigh muscle is most commonly used. Intramuscular route is the best route. Now, apart from intramuscular route, I can also give this medicine by subcutaneous route, and I can also try IV route, which are less commonly asked question in your exam. So intramuscular route is the best route to give adrenaline for anaphylactic shock. Now, guys, for cardiac arrest, I will use this medicine concentration as 1 is to 10,000. So 1 is to 10,000 is a concentration that is zero point 0.1 milligram drug per ml. So this contains zero point 0.1 milligram per ml. Now, the dose of the medicine that need to be given to this patient is 1 milligram. So whenever I want to give 1 milligram of the above medicine, I have to give 10 ml of the liquid. So volume of the medicine is 10 ml, and the route of administration is IV or intraosseous route. So here the route is intravenous or intraosseous. Now for intraosseous route, medicine is preferably given in the tibia. Medicine is preferably given in tibia. This is how we calculate the medicine dosage, and this is the dosage of the adrenaline in cardiac arrest and anaphylactic shock. Now, apart from that, it is also given with local anesthetics. In local anesthetic, this is given in dilution of lakhs. Like this can be given as 1 is to 2 lakh, 1 is to 4 lakh, 1 is to 6 lakhs, 8 lakhs. So different type of concentration is there. So question number 15, answer is C, intramuscular. So let's talk about question number 16. So question number 16 is based on dobutamine. So dobutamine is a drug which this will act on which receptor? So this medicine mainly act on beta 1 receptor. So this medicine mainly act on beta 1 receptor, and by acting on beta 1 receptor, this medicine can stimulate the heart. Now this medicine which can stimulate the heart, I can give this medicine in two type of dosing pattern. I can give this medicine in low dose. I can use this medicine in high dose. So when I use this medicine in low dose, this medicine will increase force of contraction of heart. And when this medicine will increase force of contraction of heart, I will use this medicine as inotropic drug. I can use this medicine as an inotropic drug, and I can use this medicine for the treatment of cardiogenic shock. So this medicine is one of the drug that we use for cardiogenic shock as an inotropic drug. It can increase the force of contraction. But when I use this medicine in high dose, this medicine can increase the heart rate. And by increasing the heart rate, this medicine can put load on the heart. And when this medicine can increase load on the heart because of tachycardia, I can use this medicine in stress echo. So in stress echo, I will give this medicine in high dose. In treatment of cardiogenic shock, I will use this medicine in low dose. Now this question is based on dobutamine. So dobutamine belongs to a class of drugs. We call them catecholamines. So we call them catecholamines. If we talk about catecholamines, So we have the medicine like dopamine over here. We have the medicine like adrenaline over here. We have a medicine like noradrenaline over here. We have a drug like dobutamine present over here. We have a medicine like phenoldopam. So we have the medicine like phenoldopam. And the last medicine here is isoprenaline. So six medicines are there which are known as catecholamines: dopamine, adrenaline, noradrenaline, dobutamine, phenoldopam, and isoprenaline. Now, dopamine is a drug. This medicine can act on three receptors: D1, beta 1, and alpha 1. So DBA. Like you can remember like this way: ABCD in reverse order. So write down ABCD, put 1, 1, 1. So D1, beta 1, alpha 1. Now, adrenaline is a drug. This medicine will act on all alpha, all beta receptor. Now, noradrenaline will also act on all alpha, all beta receptor, but this will not act on beta 2 receptor. So, noradrenaline starts with word no. This medicine has no action on beta 2. Now, dobutamine only act on beta 1. Phenoldopam is a drug. You can find out it's in its name the word dopamine. So, this medicine will act on D1 receptor, dopamine 1 receptor. And isoprenaline is a drug. This medicine will act on all beta receptor. This medicine will act on all beta receptor. So isoprenaline will act on all beta receptor. So question number 16 answer is D Delhi. Now let's move on to question number 17. Question number 17, a pregnant female consume high amount of alcohol in first trimester. Now what is a possible effect that can be seen in a baby? So baby can be born with fetal alcohol syndrome. So baby can be born with fetal alcohol syndrome. And in fetal alcohol syndrome, the baby can have the long philtrum. So baby will have the long philtrum, not the enhanced philtrum, right? So this statement is wrong. So baby can have the long philtrum. So baby can have the long philtrum, and when the baby philtrum is long, like you can see this depression is long, then the upper lip become thin. So baby has thin upper lip. So baby has thin upper lip, long philtrum. Baby has the presence of small palpebral fissure. So small palpebral fissure will be there. So long philtrum, thin upper lip, plus this baby will have the microcephaly. When you do the MRI, you will find microcephaly in the MRI. So microcephaly will be there, and when this baby will start going to school, the baby will have the poor academic performance. So baby will have the poor academic performance. Baby can have the hyperactive. Baby can have the hyperactive behavior. So baby is hyperactive, having microcephaly, thin upper lip, long philtrum. Baby can have the small palpebral fissure. So all these things will be there. Right? Question number 17. Answer is C. This is fetal alcohol syndrome. So let's move on to question number 18. So we're left with few minutes only to finish this session. So which opioid has no additional anticholinergic property? So which opioid has no additional anticholinergic property? So here you can mark the best answer as tramadol. So tramadol is a drug which will act on mu receptor. Tramadol will act on mu receptor, and this medicine is a reuptake inhibitor. This medicine is a reuptake inhibitor of noradrenaline and serotonin. So this medicine mechanism of action is it's a reuptake inhibitor of noradrenaline and serotonin. Also, this will act on mu receptor. Apart from that, all the three medicines have some anticholinergic property present in them. So question number 18, this is fact-based question regarding the tramadol. Tramadol will not have anticholinergic property. So question number 19, if we talk about patient has got community acquired pneumonia after staying in some air conditioned environment, which organism is responsible? So this is a microbiology question. I don't know why it has come to the pharmacology, but still the answer is Legionella. So Legionella is a bacteria that is quite commonly seen in those patients who live in who stay in hotels where the air conditions closed room where there's no air ventilation, closed rooms are there. So this bacteria can cause infection in these patients. So the drug of choice for Legionella is important. So pharmacological point of view, I can tell you the drug of choice for Legionella. So drug of choice for Legionella is azithromycin. So azithromycin or the macrolides are the best medicines for the treatment of Legionella. If we talk about chlamydia, chlamydia drug of choice is doxycycline. Chlamydia drug of choice is doxycycline. Pseudomonas drug of choice is ceftazidime. So Pseudomonas drug of choice ceftazidime, doxycycline drug of choice chlamydia, Legionella drug of choice azithromycin, and Staphylococcus drug of choice depends on the type of resistance. Like for example, if I say MRSA, which is quite common, so here you can mark vancomycin as the best medicine. So vancomycin you can mark as the best medicine. It's a methicillin resistant Staph aureus. So question number 19, answer is azithromycin, drug of choice for Legionella. So question number 20, which of the following drugs are used to dilate cerebral vessels? So the answer here is nimodipine. So nimodipine is a drug which have a special affinity for cerebral vessels. It's a drug of choice for reflex vasospasm. It's a drug of choice for reflex vasospasm that is seen after subarachnoid hemorrhage. So after subarachnoid hemorrhage, patient can have the vasospasm. So nimodipine can dilate these blood vessels, right? So there are three calcium channel blockers which start from alphabet Ni. One is known as nimodipine. Second is known as nifedipine given in this MCQ. We have one more that is known as nicardipine. So please remember, nimodipine, drug of choice for subarachnoid hemorrhage. It is given for meninges problem. So MO stands for meninges problem. So for meninges problem, we give nimodipine. Nifedipine is given for fetal problem or the female problem. So it's a drug of choice for preterm labor. This is a drug of choice for preterm labor or female problem. Now, nicardipine is given for cardiovascular problem. It's a drug of choice for hypertension crisis. This is a drug of choice for hypertension crisis, that is nicardipine, right? Now, apart from that, guys, the other medicines given in this MCQ, verapamil is an anti-arrhythmic drug. Verapamil is a calcium channel blocker, which is an anti-arrhythmic drug. It's a second drug of choice for PSVT. It's a second drug of choice for PSVT. An important side effect of verapamil is constipation. Important side effect of verapamil is constipation, and this medicine should not be given to a patient of congestive heart failure. Verapamil should not be given to a patient of congestive heart failure. That is all about question number 20. Answer is nimodipine. Some students make the mnemonic like this way. Modi is a head of everyone. So Modi is the head of the country, and this is given for the head problem, that is subarachnoid hemorrhage. So the name is Modi. It's Modi and head problem. That is all from my side, guys. 20 questions we have discussed in this rapid fire round of 1 hour. So in this 1 hour, we people have covered 20 questions. We have given 3 minutes to each question. After that, if you have any doubt in any MCQ, please message me on this number, right? 9999663325. This is my number, WhatsApp number. In case you have any query, please message me on this number. And I am also there with you on the Telegram group. So in case you have any doubt in DBMC, MDS Telegram groups, I'll always be there and happy to help all your queries. Right, guys? So please take care of yourself and keep studying hard. All the best for your exams. Take care.